On April 25th, 2014, I tore my ACL at a volleyball tournament in Minneapolis, Minnesota. On June 10th, 2014, I had my knee surgery and about 8 months of physical therapy ahead of me. This picture was taken 3 days after my surgery. When I was in physical therapy, it sucked not being able to lift up my leg due to the muscle loss. But I also had fun when I was in there. I had a great relationship with my physical therapist, which is part of the reason why I'm considering becoming one. Another reason is that I know that when I'm older, I want to stay involved in sports. And I also want to be able to help people at the same time, so physical therapy is a perfect fit. Hi, my name is Michelle Krenowitz, and I'm a senior here at Frisco High School. This is my first year in ISM. I play school and club volleyball. I'm also a part of the orchestra. The picture on the left is my parents and I on parent night during volleyball season. The picture on the right is a picture of my sister and I in Atlanta. She is 12 years old, plays the violin, and she also golfs. I took ISM because I knew of the other people who took it and recommended it to me. They told me about all the benefits of taking this class. You can choose whatever topic you have, or choose whatever topic and have total freedom and control of what you were studying. Also, they told me it was a great way to see if you want to keep pursuing the topic in college and as a career. It is better to find out something now than in college when it is already too late. My quote is, "You can't have $1 million dream with a minimum wage work ethic." And my quote applies to many kinds of situations. Work ethic is very important, and it builds character and is always making sure you're doing your best. First, I'll talk about my interviews. My first interview was with Lorenzo Veit. He's currently the lead physical therapist in the sports medicine department at the Scottish Rite Hospital. He was also my physical therapist at Michael Johnson Performance. Something he told me in our interview was that he wanted to stay in sports, so that's something we have in common. He also told me to be versatile, which means exploring the different sides of physical therapy, so not only being involved with sports, but maybe be doing like occupational or pediatrics. My second interview was with Christy Russo. She works at Edge Physical Therapy, and during our interview, she told me about more of the negative sides when physical therapy. She told me that she wasn't able to have a job during college, which kind of sucked, having to pay off like debt and stuff. She also told me that due to a lot of studying, she had a limited social life. And something she also told me was physical therapists need to stay updated with new research, and it will make you become more successful. My next interview was with Dave Ziegler. He is the physical therapist at the Institute of Sports and Spine Rehabilitation in Plano. He works with musculoskeletal injuries, and these injuries include the form, support, and stability of the body. He told me that when he first got into physical therapy, his cousin was interested first. So he would always look at his notes, and then he took more of an interest as well. He told me that when he was in college, he had to sustain a high academic performance. Not only to do well, he had to do better than the other students around him. Some other advice he gave me was go right into an internship after college. Spending time in different settings will make you learn better and faster. And instead of working on the healthy patients in school, or the healthy students in school, you actually get to work with real patients, and you have on-the-job training. My next interview is with Amber Ingram. She's the physical therapist at the Performance Chiropractic and Sports Medicine. She told me that when she first decided she wanted to be a physical therapist, it was not until after college, and she said she loved working with people and in sports. One of her main techniques is dry needling. So this is like similar to acupuncture, but it's not. So rather than using a few needles, rather than using a whole bunch of needles, she uses only like up to 3 or 4, and it has immediate results. My last interview was with Laura Salim. She was also my physical therapist at Michael Johnson, and currently she's the inpatient physical therapist at the Medical Center of McKinney. Something interesting she told me is how she got started into physical therapy. Her brother was in a car accident in high school, and so she saw him progress through physical therapy, and she saw that it was something that she wanted to do. Something interesting she told me is that she was a student athlete, and she played basketball. So not only having to perform in the classroom, she had to perform on the court. And some advice she gave me was trying to experience the different levels of physical therapy. So kind of like what Lorenzo said, and it made her learn better and become a better physical therapist. One of her other techniques that she uses is humor. So it gained a lot of trust in her patients, because I know when I first went to her, she gained my trust really quickly. Next, I'll talk about my research. My first research assessment was over ACL injuries in active women and girls. So over the years, the ACL injury rate has gone up, and there are many factors that play into it. So the intrinsic factors are the things that deal with the anatomy of the body. So the first thing I'll talk about is the Q angle. So this is the angle from your hip bone to your kneecap, and it represents the direction of force that the quads put on the knee. Another factor on the body is female hormones, and it affects the development of bone, muscle, and connective tissue. The extrinsic factors is like what you do. So something like that would include mechanics. So this would be poor balance. If you aren't able to balance your body, then your knee will collapse and go to a tear. Something else is the level of conditioning, and if an athlete is fatigued, then it can decrease the protection of the knee. Also, if you overuse your weak muscles, it can cause stress to your legs. And something else I read was specific skill training, and it enhances muscle control. And with muscle strength, men are typically more stronger. They're stronger than females, and women have a lower quad to hamstring ratio. So men have more equal balance in their muscles rather than women. So women have stronger quads than hamstrings. And something interesting I read about in this article was shoe support. So a lot of tears can be related to what kind of shoes you're wearing and what kind of activity you do. So wearing appropriate shoes for the activity and playing surface is also a big factor. My second research assessment is called the Occupational and Physical Therapy Approaches to Sensory and Motor Skills. So this is kind of different from the sports side. So this mainly talked about kids who had developmental problems or who experienced traumatic injuries. And it's about building a strong foundation for kids to be able to do like daily activities like riding a bike or going to school or even just interacting with other people. So something I read that was really cool was that the first sign of developmental problems can be difficulty feeding, and so not being able to gain the proper mechanics leads to secondary impairments. And I related this to the ACL injury because if an athlete can't develop basic movements, then they cannot return to play properly. My third research assessment was over the evidence-based medicine and practice in sports physical therapy. Out of all my interviews, they all mentioned about evidence-based medicine, and I didn't know what this was, so it was good to research. And so it uses the best available evidence to make decisions on patients' conditions, and it will improve healthcare quality. And the article explained 5 different steps. The first step is to build a clinical question, which is based on the background of the patient's injury and specific treatment. The second step is to search for the best evidence. The third step is finding the quality of the evidence. The fourth step is applying the evidence to the patient. And then the fifth step is evaluating the evidence-based medicine and seeing if it helps or didn't help the patient. My fourth research assessment was about the Graston technique. This is the use of metal tools to break up scar tissue or tight muscles. And when people rub this on your skin turns red, which shows increasing blood flow. And then, from personal experience, it's very painful, but it made me feel like I could do more activity after. My fifth research assessment was at the UNT field trip. So my first class was the biology class. It was a class for freshmen, so there was 200 people in the class. And it talked about the genetics and inheritance. And at the end of the class, the professor showed a group of us his aquatics lab. So we got to see all the different animals and all his different experiments. My second class was a chemistry class. However, this there was a mix-up with the time, so I was only able to interview him with another student, and he was really cool. And then my last class was sports psychology. So we talked about the importance of communication. So this meant like nonverbal and verbal communication. So how you say something can affect a player and how it can affect the game as well. My sixth research assessment is about the dry needling in clinical practice. So this is what my mentor uses. So this is the use of thin needles, and it is used to reduce pain or stiffness in the muscles. And when using this, it can cause a twitch, which means the muscles are regaining its function. And it can also be used with electricity or electrical stimulation, and it causes the muscles to twitch even more. And to practice dry needling, you have to be certified. Next is my original work. So I plan to prevent ACL tears, or find a way to prevent it. So for my experiment, I want to have two groups. So I'll have a control group and an experimental group. So for my control group, they'll just do the daily off-season activities. And then my experimental group, I'll like pull them out of athletics and then create like a plan based on their weakness in their legs. So first I tested their strength. So this included like their squats. And so I looked for their form to see if their knees would turn in and see if their ankles would turn in. And then I also looked for that in their single leg squats. So a majority of them had trouble with single leg squats because they couldn't balance on their one leg and squat. And then another test I did was a manual test. And so I did, so I'd have them lay down and I would push on their legs to see where they were weak. So like some of them had weaker hamstrings than others, and some had weaker quads than others. So based on their weaknesses, I have created like a spreadsheet. So based on a scale from 1 to 5, 5 being the strongest, they will have plans based on where they're weak. So my mentor experiences. My mentor is Amber. She works at the Performance Chiropractic and Sports Medicine in Plano. Coach Goff actually gave me her contact information, and so I went for an interview and I ended up really liking her and her facility. She has a variety of patients. She does a lot of athletes and non-athletes, but most of her athletes are triathletes, so it's really cool to see all the different activities they participate in. So then she does the dry needling, and I have a video to show her dry needling. And it's the third video.
So if somebody's having pain and you're having trouble getting rid of pain, the treatment of dry needling can get deep into the muscle to release the pain. So what it does is it takes something that's dysfunctional and it makes it functional. Let's say you have a muscle that's tight and you can't release that tightness. Getting in there with a needle can reset that muscle and get rid of the trigger point. For Shay here, we're going to treat her in just a minute for her upper neck. She's been having some neck pain, even difficulty turning her head. And so after the needling, she should have more range of motion and less pain. So performing dry needling, the patient is put in a comfortable position. I look and I find spots that are really tight, maybe a trigger point that needs to be released. If I find a tight spot, like right in there, I'm just going to take the muscle, make it real comfortable in my hand, and just gently put that needle right into the tissue. So what I'm looking for is I'm looking for the muscle to relax and release. I may even see a twitch. I don't know if you can see that, but her muscle kind of twitched there. And what happens when it twitches is it increases blood flow and it resets the muscle to functionally acting like it should work. Sometimes the muscles just get real tight and they can't work.
There's a button right next to the gear. Okay. And then my mentor let me sit in on a couple of her patients that participated in dry needling. So I've seen each patient has actually been different. So the very first patient I saw was he had knee surgery about a couple months ago, and then he complained of tight IT bands. So she put 4 needles up on the side of his leg, and he actually had a very bad reaction to it. So the first time I saw this, I thought dry needling was very painful, but he had a really bad reaction. And then the next patient I saw was a coworker who had complained of shoulder pain. So I've seen him needle his shoulder and his bicep. And then the most current patient I've seen was a lady who complained of neck pain and headaches. So Amber would put needles in the back of her neck to get rid of that tightness in her neck, and then she did to get rid of the headache. She put needles like in her jaw and her kind of like her temple. And then the next time I saw her, she said that her headache's actually gone away. So as you can tell, there's like immediate results. So I thought it was really cool. And then a couple weeks ago, she kind of let me be her assistant. So I got to like help patients like work on their balance. Like I tossed like a weighted ball to like a girl who was working on balance, and then I got to help a lady work on the stem machine, and then I helped a guy like get hooked up to the ice machine. So it was like, even though it was like little things, it was really cool. So it was kind of cool to see like being on the other side of physical therapy. So like rather than being the patient, I got to be the physical therapist. So that was probably like the coolest day ever. And so I found out like physical therapy is something I would really like to pursue, and it kind of gave me more perspective as I go in for each mentor visit. And then for college, I plan to go wherever volleyball can take me, because I want to play college, and I don't really care where I go. Just maybe it can be a small school, and then maybe major in biology, and then focus on physical PT school. So thank you. I was under time again.
Can y'all stop the camera?